Hello, my name is Vance Broach and I'm a gynecologic oncologist at Memorial Sloan Kettering. Unfortunately, the SGO annual meeting was again held virtually this year as the COVID pandemic prevented us from gathering in person. I was particularly disappointed that the Society of Memorial Gynecologic Oncologists annual dinner and presentation was not possible this year, as it is always one of my favorite evenings during SGO. I very much hope that I'll be able to see you all in person next year at the SMGO dinner, but I'm glad that we can connect virtually with you in this way. Over the next few minutes, I hope to highlight some of what I feel were the biggest takeaways from the meeting and the outstanding work done by MSK faculty and fellows. One of the interesting aspects of the virtual meeting was the volume of content available to SGO members and attendees. Additionally, this content, along with numerous recorded talks, remains available to meeting attendees on the meeting website. And I would encourage you to go have a look at some of these talks, particularly those by current fellows, which I will highlight later on. To start, during the opening plenary, Dr. Vicky Macker from MSK presented results from her study comparing lenvatinib and pembrolizumab to chemotherapy in patients with advanced or metastatic endometrial cancer. This study impressively showed improved overall and progression-free survival among women treated with lenvatinib and pembrolizumab compared to chemotherapy, and what is clearly a promising treatment approach to this disease. In the same session, Dr. Sarah Temkin presented her work evaluating gender-based bullying and microaggressions, as demonstrated in a WGO survey. She identified the alarming frequency of gender-based microaggressions and episodes of bullying, which are unfortunately prevalent in our field and which must be addressed. Subsequent presentations and plenary sessions evaluated the way we select patients for primary debulking surgery. Several groups presented their work utilizing laparoscopy to assess for resectability among newly diagnosed ovarian cancer patients. As we work at MSK to refine our own algorithms, which are based on preoperative imaging, it's important to keep in mind the numerous modalities available to us for determining disease resectability in these patients. Along with these studies were presented strategies for optimizing surgical outcomes in those patients who are older and frail, but who would benefit from surgical management of their disease. Another impressive report by Ursula Machelonis evaluated long-term trial results from the SOLO-1 study, which demonstrated that 50% of patients who received olaparib in this trial were progression-free at 5-year follow-up, versus 20% in those who received placebo. Clearly, the use of PARP inhibitors is extending the lives of these patients and represents an incredible breakthrough in our field. Another interesting presentation by Laura Chambers, a fellow at Cleveland Clinic, presented her group's work evaluating cisplatin and paclitaxel versus cisplatin alone in women receiving HIPEC and interval debulking surgery with stage 3 high-grade serous carcinoma. In this non-randomized study, she presented impressive difference in progression-free survival of 11 months in the cisplatin arm versus 22 months in the cisplatin plus paclitaxel arm. This interesting study certainly adds to the body of literature from which we draw when determining the appropriate setting for HIPEC use, and helps us better understand which treatments to select for our patients. In an interesting discussion by Warner Huh and David Cohen, they discussed what they felt to be a point of crossroads in the field of gynecologic oncology. They discussed several changes in our field over the past several years, but highlighted particularly the shift in our field away from aggressive and radical surgical management of gynecologic cancers towards non-surgical management. They also discussed the shifting needs of trainees not only in response to this move away from surgery, but also in our approach to the format of training. They discussed that a fundamental sea change in the way we train house officers, particularly splitting obstetrics and gynecology, may be required to continue to provide the most high-quality care to our patients. Our involvement with ABOG and the evolution of this training paradigm will continue to be a source of discussion and consideration in the coming years. Now I want to take a moment to highlight the exceptional work done by the MSK Fellows. Each year, MSK Fellows are invited to present oral presentations on their exciting work, and this year was no exception. 4 of the MSK Fellows this year had oral presentations at this year's meeting. Renee Cowan presented her work evaluating the responses from an SGO survey of racism experienced by gynecologic oncologists. She found that non-white SGO members were more likely to suspect their race or ethnicity negatively affected their ability to be promoted, their actions were unfairly critiqued on the basis of race or ethnicity, were more likely to experience discrimination and had negative experiences in training, to name a few. Dr. Cowan is one of the national leaders in improving equity in our field, and her work adds tremendously to this endeavor. Another MSK fellow, Katie Miller, presented her work evaluating CDKN2A loss of function alterations, which may be a target for patients with uterine sarcoma. She found that 10% of patients with uterine sarcomas had CDKN2A loss of function alterations, and that these alterations do not occur in patients with P53 or RB1 mutations. Furthermore, these patients have poor outcomes, and CDK inhibitors may be a useful treatment modality for these patients. Kimberlee De Santis, a third-year fellow, evaluated provider perception of racial healthcare disparities among women with gynecologic malignancies. In this study, she aimed to identify patterns of provider perception of disparities among Black patients with gynecologic cancers. She found that while most providers agree that Black women have worse oncologic outcomes, they also did not feel that this was true of their own patients. This important work adds greatly to our ability to improve equity in treatment of gynecologic cancers. Eric Riostoria, our pelvic reconstruction fellow, presented an updated report of pelvic exoneration at Memorial Sloan Kettering during a surgical session dedicated to this procedure. He reported our experience with 100 patients who underwent pelvic exoneration for curative intent. While the rate of major complication remains high for this patient population, 1/4 of patients were alive at 5 years, and this procedure remains a potential curative option for appropriately selected patients. The exceptional work of many of the other MSK fellows, including Olga Filipova, Leah McCarzel, Evan Smith, and Bill Zamorelli, were also on display during virtual poster presentations in this meeting. Overall, while we were not able to be together for this year's SGO meeting, it was still a wonderful meeting with exceptional presentations and thoughtful discussion. I very much hope I can see you all in person next year.